Hi, my name is Dr. Yannis Avramis, and I am a spine and scoliosis surgeon on the medical staff at Baylor University Medical Center. I also serve as the medical director of scoliosis and spinal deformity surgery at Baylor University Medical Center. Scoliosis is a disorder of the spine in which the vertebrae curve and rotate, creating an S or C-shaped curve in the upper or lower back. Patients can experience a mild case of scoliosis with little pain or deformity, while a more severe case of scoliosis can result in pain and spinal imbalance that can cause difficulties walking, breathing, and carrying out simple activities of everyday life. People with scoliosis can experience back pain and numbness into the legs, as well as trouble standing upright. All of these symptoms make it more difficult to carry out our activities of daily living and can significantly decrease one's quality of life. The symptoms do not occur solely because of the scoliosis. People with scoliosis also commonly experience degeneration, nerve pinching, and possibly spinal instability that add to arthritic pain and nerve pain. These spinal problems can create a varying group of symptoms for each individual patient with scoliosis, and the symptoms can be different for different people. For adults, there is usually a component of kyphosis, or an inability to stand upright. Each person with scoliosis has a unique experience and will require an individualized treatment path. The three main types of adult scoliosis are referred to as congenital, idiopathic, and degenerative. Congenital scoliosis occurs when there is a malformation during growth of the spinal bones, causing an abnormal shape or even a partial fusion of the bones that then causes the spine to curve abnormally. This type of scoliosis is the most common form and has an unknown etiology, although there is a genetic inherited component. Idiopathic curves tend to fall into reproducible groups. There is also significant research that has been done and is currently underway that provide evidence to help develop treatment plans for patients. I use the findings established in research to help my individualized treatments for my patients. Degenerative scoliosis occurs when there is substantial degeneration of the spine, causing either instability or abnormal alignment, or both. Oftentimes in adults, idiopathic and degenerative scoliosis are present at the same time, meaning degeneration within an idiopathic curve can cause increase in the curve size, pain, and nerve pinching. It is important to keep in mind that scoliosis treatment needs to be tailored to the individual person. Treatment of scoliosis, like most spine conditions, is based on the symptoms and severity of the condition. If there are no or very mild symptoms, initial treatment may simply entail monitoring for curve progression. Curve progression can occur with or without pain, and if the progression is significant, it is generally an indication for surgical correction. Surgery can help prevent further curve increase and protect from potentially harmful effects on the internal organs such as the heart and lungs. If the symptoms do begin to increase, anti-inflammatory medications, muscle relaxers, and physical therapy for core strengthening can be helpful. Research shows that narcotic medication should be avoided if at all possible. The next tier of treatments often involves pain management through epidural steroid injections and facet injections and ablations. Ultimately, surgical correction is the definitive treatment for scoliosis. The two major indications for surgery are curve progression and significant symptoms. The symptoms are generally back pain in the area of the spinal deformity and leg symptoms of pain, numbness, and weakness. Surgery for scoliosis can be very involved, and the amount of improvement it can make for a person, both from a symptom improvement and quality of life, is dramatic. The type of surgery is different for everyone, but much of the process is the same. Once a clear diagnosis and treatment plan is established and we have decided to proceed with surgery, a preoperative clearance is arranged. Before surgery, several clinic visits are planned where the patient and doctor can review labs and x-rays and give the patient the opportunity to ask questions. The day of surgery, you will be surrounded by dedicated nurses and techs and other physicians who are trained and experienced in having our spine patients achieve the best outcome. Not only are the personnel second to none, but our hospital has a new advanced operating room custom built specifically to perform these complex cases. Following surgery, physical therapy and rehabilitation will begin, which is just as important to the total treatment plan. There are specially trained spine-certified physical therapists throughout the Metroplex to help patients recover after surgery. Scoliosis shouldn't keep you from enjoying all life has to offer. If you're experiencing scoliosis symptoms, make an appointment with a board-certified scoliosis surgeon. Visit bswhealth.com/scoliosis to find a physician or to learn more.